The success of artificial intelligence technologies largely depends on how doctors interpret and act on the tool's risk predictions, and that requires a unique skill set that many people rely on. Currently lacking. As artificial intelligence systems like chatgpt are used every day, physicians will begin to see these tools integrated into their clinical practice to help them make critical decisions about diagnosis and treatment. Treatment of common medical conditions. These tools, called clinical decision support (CDS) algorithms, can be extremely helpful in helping healthcare providers determine, for example, which antibiotic to prescribe, whether or not to recommend risky heart surgery. However, the success of these new technologies largely depends on how doctors interpret and act on the tool's risk predictions, and that requires a unique skill set that many who are currently lacking, according to a new paper in Medicine by professors at the University of Maryland School of Medicine, UMSM. CDS algorithms make predictions under conditions of clinical uncertainty, which can include everything from regression-derived risk calculators to complex machine learning and artificial intelligence systems. They can be used to predict which patients are most likely to develop life-threatening sepsis from uncontrolled infections, or which treatments are most likely to prevent sudden death in patients with the disease. Highest heart. These new technologies have the potential to significantly impact patient care, but doctors must first learn how machines work, said Daniel Morgan, MD, MS, professor of epidemiology in Community Think and Act, before they can incorporate algorithms into their medical practice. Health at UMSM and co-author of The View. Although a number of clinical decision support tools have been integrated into electronic medical record systems, healthcare providers often find current software cumbersome and difficult to use. Physicians don't need to be math or computer experts, but they do need a basic understanding of how an algorithm functions in terms of probability and risk adjustment, but most have never been trained. Build on these skills, he said. Catherine Goodman, JD, PhD, Assistant Professor of Epidemiology in Public Health at UMSM and co-author of The Opinion.